Yeah, so it's lovely to be back with all of you. I was really looking forward to connecting with you all again. And today, just want to do the naturopathic approach really to digestive health in ME. And I'm sure you guys have looked into a lot of this before and have heard things before, but hopefully you'll learn something new or be given some kind of a reminder at least of things that we can do and where we do have abilities to make changes and what can help in the long run. Certainly know myself, I've used a lot of these personally, if not all. And yeah, they really do work with everyone that I see these, everyone's an individual, everyone has different reactions to different things, but I've included enough in this today that everyone can get something from it. So yeah, so that's it really. So talking points. For anyone who hasn't seen me before or is not familiar with naturopathy, I'll just give a brief, I don't want to bore everyone, I'll give a brief kind of a summary. I don't want to go rehash everything again, but also people might not know. So this is just a little bit about me. Have a look afterwards if you want. It's just to let you know who I am, if you're not familiar. And so what is naturopathy? Again, not to kind of go back into too much detail, but really what naturopathy is it's a holistic medical system, and holistic being that very aware of the interconnectedness of all the different systems in the body. And so looking at taking a multimodality approach to combine traditional healing with the up-to-date scientific evidence and research. So it's just really trying to bridge the gap between the old and the new, and to use alternative, I suppose we'd say, practices to do so. And really, with naturopathy, what we're doing is we're supporting and enhancing the body's own ability to heal itself. So, as we know, when we're very sick, the body often does need quite a bit of support. But really, in naturopathy, what we're trying to do is let the body balance and do what it does best. And so, guide it and steer it and direct it in that direction by giving it everything that it needs to find its own balance. And so, sometimes we're really, as much as possible, we're really looking at the least amount of intervention in order for that to happen. Because everybody's system is different, we don't know what that is in each system. And so when I work with people, obviously I trust them, and we go through, they know their own body the best. We go through what their needs are, and they know what might or might not work for them, but obviously they're guided and supported. And that's what the naturopath really should be doing, is listening to the person they're with, because they'll know themselves better than anyone, obviously. But we're looking for the least amount of intervention, and then gradually increasing that over time if needed. If you need to go in with heavier dosing, if you need to go in with more support, we will. But ultimately, it's a kind of a first do no harm approach, really, where we're just looking at, okay, this is the least amount that we need in order to tip the scales back. And as we know, with chronic conditions, ME, it's a complex condition, to say the least. That's an understatement. And so there's often multiple body systems involved, and that's why today we're going to look at the digestive aspect, because as we know, that can affect everything else too. And we're really looking to treat the root cause. That's a big ask. We get that, so especially when there is still limited information about certain conditions. But at the same time, again, what we're looking to do is to get to the deepest aspect of what's happening and to treat that rather than just separating the body systems into parts too much. We really want to understand the interconnectedness and the whole of the system. So again, just individualized approach. Everyone is different. Uh, as we know, you can have the same condition but very different expression of it, similarities but differences. Preventative medicine is obviously key as well. And that's preventing a condition from progressing further as well if you're already in a place where you have a condition. Treating the whole person. So we're really looking at the physical, the mental, the emotional, and the spiritual if the person is that way inclined, and treating the cause where possible as well. So that's just, again, another kind of a summary of naturopathy, how the naturopathic approach is, I suppose, how naturopaths would approach, and how it's different often to the more kind of modern Western medical system. And so what naturopaths would use very often, dietary and lifestyle counseling, really looking at, even I suppose with dietitians, they look at very specific levels of nutrients. So do naturopaths. if the person is open to that, and looking at nutrient deficiencies, things like that, lifestyle counseling, obviously, because as we know, then the contributing factors often are stress and lifestyle aspects can be altered. Nutritional medicine, herbal medicine, both as a preventative, as tonics, as support, but also as treatment options as well where needed. Flower essences are beautiful because, again, often people with ME are very sensitive, and there often are emotional and psychological aspects, spiritual aspects, we could say as well. So flower essences are beautiful, energetic frequencies, are vibrational. They're very good for sensitive people, for kids, animals as well, because they don't interact with other medicines. They can work on the deeper levels of the emotional being. And so they're often incorporated to help, I suppose, be more receptive to, not necessarily consciously, but subconsciously more receptive to healing as well if there's any emotional blocks needing support. Homeopathy, for all of those that are familiar, I'll just give a brief summary for those that are not. Homeopathy is it's an energetic medicine as well. It's often kind of rejected by a lot of, again, the modern Western medical, but I've found amazing results when you get the right remedy with homeopathy for the right person at the right time. It can be amazing. It's really good for sensitive people. I've used it a lot personally for myself and in the past. And New Vistas in Ireland, which a lot of people are probably familiar with, is a great company that does a lot of homeopathics and nutritional homeopathics. So it's a bit different to a homeopath in that they don't prescribe. They do ready-made formulas. They don't prescribe necessarily specific homeopathics on their own. But yeah, there are definitely opportunities to use that in your healing journey as well. And naturopaths who are trained in homeopathy can help you with that too. So homeopathy is an energy medicine. Really, it's about very high dilutions of substances, and it really believes that like treats like. So the founder of homeopathy really believed that the substance that would cause the symptoms in somebody, if you were to ingest it, would be the exact substance in very small, high diluted amounts would actually be able to treat the very symptoms that that substance itself would cause. A little bit confusing when we think about it sometimes, but it actually is absolutely amazing. You can use different forms of homeopathy, but yeah, the New Vistas ones are easily accessible in shops, and they're nutritional ones, and they can be helpful. Now, saying that, homeopathy sometimes, again, without guidance, you can move yourself too far in one direction. So it is good always to check in, use your intuition, obviously, as well, which I'm a big proponent of. But also, yeah, just seek the guidance of a healthcare provider that's trained in homeopathy. If you want to go down that road, it's very good. And iridology is something that a lot of naturopaths use as well, which is the study of the iris. Quite fascinating. I wouldn't use it solely on its own, but it can contribute. You know, it can help to form a treatment plan. And so you take photographs of the iris and you analyze it, and you look at different patternings, colors in the iris, and it can show some genetic dispositions to certain organ types or organs having certain disease types and or maybe weaknesses and strengths. And so that's fascinating as well. It's really good to add into your overall plan. So coming back to the digestion and the ME, what I was looking and focusing on was the most common types of digestive conditions, I suppose, or digestive imbalances in ME. So obviously, um, there's many digestive conditions out there, and quite from severe to mild. But this, I've tried to group them into the kind of most common for ME, which is basically what I'm kind of focusing on is IBS, irritable bowel syndrome, and the symptoms associated with that. Not specifically looking at like Crohn's or ulcerative colitis and things like that in this case, although I'm sure there are people out there that have both conditions, but this is more just the digestive general digestive symptoms that can come through most commonly. Also, a lot of the remedies here that are indicated for these symptoms, of course, if you do have those conditions and the more severe conditions can also be used. So we look at the kind of typical microbiome imbalance symptoms which all of us, I'm sure, at some stage have experienced at least one of these. But you may have many, if not all of these as well at the moment in your current health state. So abdominal pain, that could be obviously higher, lower in the abdomen. It could be the whole abdomen if you're unfortunate. Nausea, bloating I think bloating is probably one of the most common that I would see in people, and motility issues. So you have either, diarrhea or constipation, slower or faster, or slower in that phrasing. Flatulence, cramping, even spasms as well might come in there for a lot of people. I didn't write that one down. Undigested food in the stool, which is again another key sign that you're looking for, right? There's something happening here. I'm not breaking down my food properly. This mucus in the stool as well is another indication of inflammation in the digestive tract. Acid reflux, unfortunately, again, very common for a lot of people. So where you're getting regurgitation or you're getting acidic contents into the esophagus and into the mouth. Food intolerances are very common. I suppose, again, that's one of the big ones and something that you're probably all familiar with to a degree. Body pain is another one that, again, maybe the more modern Western approach might not necessarily associate body pain, or often, to be honest, if I'm being honest, doesn't associate body pain with digestive imbalance, but actually it's very common that you'll get body pain with a microbiome imbalance. And when that is resolved or at least lessened, the body pain can often go away. And that actually was the case in my case as well. But I do see that in a lot of people. Neuralgia, again, something, nerve pain, not something that would commonly be associated with digestive imbalance, but it actually is very connected at times in people. And bladder irritation, another seemingly kind of unusual one, but actually that often does come up as well when you have an imbalance in the microbiome. So that's your kind of common signs and symptoms that I was focusing in on today. And again, a lot of those would be associated with irritable bowel syndrome banner that people kind of fall under in the medical process. So again, this is just a standard diagram, digestion process. Pretty obvious on some levels, but actually it's interesting just again to remind ourselves what organs are involved. And often the liver gets neglected or forgotten about in the digestive process, the gallbladder, the pancreas can often get forgotten about, because the pancreas, people are thinking more about insulin and blood sugar levels, but the pancreas would be providing digestive enzymes, pancreatic enzymes, obviously the large intestine and the small intestine, the rectum and the anus. So they're the kind of more obvious. But yeah, it's interesting how often people do forget about the liver, gallbladder, pancreas within the whole process of digestion. So obviously the liver produces bile and continuously produces bile, and the gallbladder will store it. And there can be, I suppose, from a more energetic perspective, like as in the Chinese medicine, Ayurvedic medicine, naturopathic perspective, we would say there can be congestion in the liver. In our terminology, there can be kind of a stagnant liver, there can be a slowing. And so what that means is really that you don't have optimal digestion, you're not breaking down your fats very well. So if you're noticing that you have difficulty with digesting fats, in that you're getting bloating soon after eating, or you're getting pain after eating fats, slower motility is also associated with poor, kind of sluggish liver and gallbladder function. So obviously the liver has many functions in the body, but in terms of directly with the digestive process, we really need those fats and those healthy fats to provide for our hormones and just many functions in the body. So it's important then that we're looking after our liver and our gallbladder health to make sure that they're working optimally as well. So yeah, that's just again, just a kind of a brief overview of that with the digestive process. And then influencing factors as to why the microbiome is out of balance. And there are many, as you can see, and many that you are probably aware of and have thought of. But again, it's a helpful reminder to put them into this group, and maybe some that you haven't thought about as much. So GIT infections, gastrointestinal infections, obviously that can be bacterial, viral, fungal, parasitic, things that we hear about a lot. But yeah, they can really go undetected as well for a long time. They can cause great havoc in the digestive system. And it is interesting, like the testing is getting better for this, but often as well, when you go to doctors' offices, they might be just testing for quite specific, more common um, parasites and more known bacteria, but actually you can come up with a negative test for that, but still have things going on. And we're as a group in human a human group and across all professions, we're still babies in the microbiome, as we all know. So there's so much to learn. There's so much to find out more about. So there's probably many things that go undetected. Our immune systems need a certain amount. It's not fear-based. Our immune systems need a certain amount of challenge. They need a certain amount of exposure to pathogens and to things that aren't as good for our systems in order to be able to build strength in the immune system and to function in a healthy way. So we're not certainly fearful about all of these things out there, but it's just more when there is a pathogenic or an infection that is running a bit rampant, the immune system isn't as strong, for example, or and so it can't target it as well. Or what can happen in the intestines as well is that you could have some kind of a in the microbiome, you could have some kind of an infection, and it's actually very good at hiding itself. And a lot of this research recently is interesting. And so you might have heard about biofilms where there can be these infections and they build protective sheets around themselves. And that can be really hard to detect if that's happening, and it can be hard to actually treat the infection because the access to actually, from an antibiotic perspective, from a doctor's perspective, or from a herbal perspective, from a naturopathic perspective, they can actually shield themselves, they can hide themselves, they can cover up. And so we need to actually break down these things that are around them called biofilms before we can actually access the infection and treat it correctly. So that also is in a good protocol, a very wise thing to be adding in if you're ever treating infections in somebody. So that they can go hidden is my point. They can be there and they can be undetected on some tests. But there's beautiful comprehensive gut analysis tests now that really are high quality and they can detect most of these. Antibiotic use and repeated antibiotic use is another influencing factor about why we might come up with microbiome imbalances. Um, it's unfortunate that that is the kind of go-to option and they're overused. And even though there's maybe less of that happening now, I guess in our age group it has happened already, and so a lot of people as in professionals as well, didn't know any better. And unfortunately, then we've been overexposed to antibiotics. And then we have antibiotics, obviously, that are just in the environment. So our microbiomes have been tested by that and often are imbalanced because of previous use. And so we need to see what balance we can bring back again through maybe some specific treatment protocols depending on the individual expression. But at the very least, what happens is there are opportunistic um, bacteria and microbes in the gut. And sometimes within the normal healthy balance, we have some pathogens that are in there. And then we also have some bacteria and microbes that are really healthy for us, but also only in specific amounts. And so sometimes with antibiotics, some of those ones that are opportunistic, like for example, like Candida, you could have Candida in the gut and it could be perfectly imbalanced in a lot of ways because it's not taking up too much space, if you like. And then you have antibiotic use, and then all of a sudden something like that that is a bit more opportunistic can take hold and multiply and really be kind of difficult to treat. So then other things that can lead to microbiome imbalances, the obvious ones in a lot of ways, the diet and lifestyle. So sugar and kind of excessive sugar use, refined foods, low fiber intake, alcohol, smoking, lack of exercise, and excess protein even can imbalance the microbiome. And then we have chronic stress, which is a big one and tricky one when you have ME, because understandably, it's a stressful thing to deal with. And so you're caught in that cycle often of perhaps you had stress and that might be a contributing or a causal factor for you getting ME in the first place, but now you're stressed because you have a medical condition that you have to deal with, and you can't escape that. You can't escape our body. So obviously that's can contribute. So we're looking at then in mental, emotional, and even physiological stresses, obviously, as well. So even very physical things in the environment. Too much exercise can be a stress as well, as we know now. That might not be uh, a massive factor for some people who can't exercise at all. But it's interesting. Sometimes again with ME, when we get bouts of energy, we might get over enthusiastic. If you're one of those people that does kind of oscillate and swing, and we can kind of push ourselves too far. And what's too much for one person, as we know, relative to the other the population, the common population, it might not be a lot considering, in someone else's opinion, but for you, maybe it's too much. So that can be a physiological stressor. Thyroid disorders as well. So if you have an undiagnosed, which is quite common in Ireland actually, thyroid disorder, especially hypothyroid, which is lower thyroid function, that could slow the motility in your gut. And that definitely leads to microbiome imbalances. The less common, but still potentially manifestation of thyroid is the hyper, and that's the overactive thyroid. That's also detrimental to the microbiome because you've got a very fast metabolism. Things are moving too quickly, and it doesn't have time to take in all of the nutrients and everything that's needed. Nutrient deficiencies for sure can lead to microbiome imbalance. Obviously, fiber would low fiber would detrimentally affect that, but also zinc, magnesium, a number of B vitamins. So we really need to make sure we're getting as much as we can into our systems, but also that we're able to break that beautiful food down and absorb it in well as well. Mold and mold exposure, chronic mold exposure definitely affects the microbiome, and hydrochloric acid imbalance. So again, for anyone who doesn't know, the stomach has acid that is needed in a very specific pH in a very specific quantity to break down food, especially protein, in the digestion process. Now, we're probably more aware, again, commonly of the hyperacidity, where we have too much acid and we're getting high acid in the stomach and we're getting regurgitation, and you've got GORD, so gastroesophageal reflux disorder, um, is commonly associated with high stomach acid. But actually, there's a very common manifestation with hydrochloric acid as well, where it's too low, and hypochlorhydria, where you have too little stomach acid, and interestingly, they present with similar symptoms. So people might think if I have acid coming up into, or, if I'm getting chest pain after eating, and tightness in the chest, or shortness of breath, and those types of symptoms, discomfort in the chest area, and the acid regurgitation, they might think, okay, I've got too much acid. And the doctor often goes straight for the proton pump inhibitors, which are the treatment for that. And actually, it's really interesting that often it can be low stomach acid. So at the end of the esophagus, there's a sphincter, and that sphincter needs to be able to open and close in a balanced way, as it should. And sometimes what happens when we don't have enough stomach acid in our stomach, that actually can hold the sphincter open and contents can move upwards. So it's something to consider, that it's not necessarily high stomach acid. The reason I'm honing in on this one and I'm really focusing in on this one is it's very common. And if you don't have enough stomach acid, to break down food, you're going to be taking in potentially the best food ever and lots of lovely, healthy, nutritious foods, but you're not actually going to be able to break it down properly, especially proteins. And what often happens as well is you'll find that that will irritate the gut lining. So again, that's going to affect your digestion for a longer period of time. We don't produce enough gastric acid to break down food. So you're really sending food down into the lower intestines, into the tract, where it's not broken down properly. We don't have access to the nutrients. And then we're creating as well food intolerances, food issues, but also it's not killing, it's not doing its job, where the stomach acid is meant to kill um, rightly so, meant to kill pathogens and any bacteria and anything that shouldn't be there lower down in the tract. So we can often find that infections are more frequent and common when we don't have enough of this hydrochloric acid in the stomach. And one of the reasons why we might not is rushed eating or stressful eating, eating when we're upset or angry. But also it can be mineral and nutrient deficiencies, which I'll refer to again later as we go. And then enzyme deficiencies, pancreas, like I mentioned earlier, especially somebody can be quite deficient in pancreatic enzymes. Again, often because of just poor digestive process, their system might be just exhausted. They're not calm when they're eating potentially, um, and their system's worn out. And so it can be helpful to have a supplement of pancreatic enzymes to help to break down food. Um, so the pancreas would normally just release these enzymes and it would help to break down the food and the proteins, fats, and carbohydrates. And if that's not functioning optimally, you will find again that you're just not breaking down foods, you're not getting the nutrients. And again, the undigested food in the stool can be an indication of that. A reason for microbiome imbalance can also be structural. So obviously, if you've had abdominal surgery, that might stay in your mind. That's a bit of an obvious one that you might think, okay, yeah, that could be something contributing. But an interesting structural one that a lot of people may not realize is something called the ileocecal valve. And that's the valve connecting the small intestine with the large intestine. And what can happen is that that valve can be poorly functioning in some people where it's just not opening and closing properly, almost like what I was saying with the sphincter earlier in the esophagus. And so it really needs to be able to do its job to be able to push the contents of the small intestine into the large intestine and also to keep out any contents of the large intestine, which are a different type of bacteria, different balance in the microbiome from the small intestine. So basically, what we're saying is this valve cannot be functioning properly and could be causing you a wide number of problems without even realizing the cause and the why. And that often will not, I mean, if ever, to be honest, I would be very surprised if a doctor would pick up on that. They're really on top of it if they do, because I've never heard of that. You could see if you're looking to wonder within yourself, okay, is that something? You can do a little test yourself. You can check it out yourself. But you can also go and see an osteopath or a chiropractor who is that you speak to and that you ask, do they know about the ileocecal valve and can they do a little adjustment? It's not at all painful, or if it is, it might just be because it's tender area in your abdomen, but it's not generally painful. It's actually a quick fix. It's easy enough to do, but it's often something that you need to do consistently over a period of time. And some people, I mean, honestly, for myself, I do it. I still have to do it all the time. I guess that valve for me doesn't function as well. If you have nutrient deficiencies, that could also be a reason why it doesn't. But also if you have issues with um, if anyone has Ehlers-Danlos syndrome or any issues with kind of elasticity, over elasticity, or maybe hypermobility in the joints, and that can be an indication that you might have more of a tendency towards having poor ileocecal valve function. Another reason that you might have an issue with that valve is if you have something called SIBO. It can be both the cause and the result of something called SIBO, and I'll come back to that later. But SIBO is small intestinal bacterial overgrowth, and that's actually very common with these digestive system symptoms that we're looking at today. So a test that I said that I'd come back to. So what you can do is find, when you're lying down, find, or even as you're sitting now, it can be helpful so you can remember it later. Just find your belly button and then find on the lower right side of your body, find that, let's say we would say the hip bone, the protruding kind of hip bone at the front, find where that sticks out. And then just with the side of your hand, you can just draw an imaginary diagonal line between the belly button and the bone that's sticking out of the hip area on the right side. And if you look down at your hand as you're doing that, and you're kind of using like the karate chop point of the hand, if you like we say tapping. If you look down at that area, just notice where is about midpoint between the two. midpoint to two-thirds, really. That's exactly kind of the area you're looking at. And that should be where the ileocecal valve is located. And when you're lying down, it's easier to do that as well because you have more access to that area. What you want to do is massage that area. If it's tender and it's particularly tender, then you know for sure there's something interesting happening there. It's not dangerous. You're just kind of gently but firmly pressing in with the pad of your finger to massage that area. You can often hear a gurgling, a release. You can feel a movement slightly when you do that. Uh, if you're unsure at all, honestly, I would just go to a chiropractor or an osteopath. Osteopaths maybe often would know of it more, and just ask them to check it for you. Once they do it and you feel it as well, you'll find that you'll be able to kind of do it yourself. And if you're interested or if you're doing muscle testing, that can be something that you can test just to see yourself. Is it open? Is it closed? Is it functioning optimally? So that's something I would definitely suggest looking into because it's very common and a lot of people don't even realize. And what can happen is that the contents, as I said, from the large intestine can make their way into the small intestine and they should not be there. And they like to colonize that area and it creates a whole myriad of problems and symptoms that you just don't want to have to deal with. Um, and then another influencing factor that I referred to earlier, poor liver and gallbladder function as to why the microbiome might be imbalanced. Also, microbiome imbalance creates more toxins, and so the liver has to deal with the detoxification of more toxins from having a microbiome imbalance. So it's again, everything is connected and goes around in these circles in the body because then you're putting a little bit more pressure on the liver to do its detoxification process, and so it's probably less optimally functioning less optimally, and then here you go around in circles. So there's some beautiful herbs and nutrients that we can use as well to support the liver and the gallbladder. Um, and as I said earlier, there's usually not one thing that causes ME. There's not usually one, there's a number of factors, there's a number of things that cause microbiome imbalances. And so the more that we can support all the systems and all the different potential factors, the better chance we have of actually coming back into. So how can naturopathy help specifically? And a lot of you will know a lot of this already, but just a reminder for those who do. Anti-inflammatory diet is a big one. And it's obviously a big one for microbiome imbalance, but the whole, everything, the immune system, the nervous system, the whole system will obviously benefit from this. What we do know is that in ME, there's inflammation. There is chronic inflammation. And so whatever we can do to reduce that, prevent it from progressing further, to balance it where possible. So what we want to do is build a consistent eating routine with regular meal times where possible and avoid eating late at night for obvious reasons in that we need our body to recover and rest and heal while we're sleeping. And so the later that we eat at night, the more pressure we're putting on our digestive system really to digest that food, and then the other systems that need to be using the energy of the body to heal and recover don't get as much time to do so. Obviously, for some people with blood sugar imbalances, eating a small amount before bedtime can help you tide through the night and not wake up in any anxiety or panic, or wake up with food cravings in the middle of the night. So obviously, a small amount of food before you go to bed can be helpful in that case. But if you're pretty good that way and you don't need it, then we would be trying to not eat past 7, half 7 in the evening, and certainly not eat too heavy a meal at nighttime. And that will help to reduce inflammation in the system. Include healthy fats. So again, we could go slowly if we know that we have difficulty digesting fats, the liver is taxed a bit, but definitely bringing in as many healthy fats as we can overall, but going gradually as much as we need to. So just introducing them slowly if you need to do that. But extra virgin olive oil, avocado is a brilliant one. Obviously, avocado has loads of other nutrients and fiber as well, and potassium, folate. Nuts and seeds, again, some people, and I understand the demographic here, like a lot of people are very sensitive. So if you have histamine sensitivity, if you're too high in histamine and you find you have reactions to histamine foods, then nuts and seeds are a bit trickier. And I understand that. But then the other options can be flaxseed oil. We wouldn't use flaxseed oil in a heated way. We would use it cold. It's cold pressed. It's stored in the refrigerator and it's maybe poured over some salad, or if you're kind of looking at warmer foods, some cooked veggies would be lovely with some flaxseed oil. In fact, that's what I had for my lunch today because I'm a big fan. I didn't think it would be, but it grows on you if you're not sure about it. Kind of has a slightly kind of a nutty, slightly nutty flavor. Wild caught fish, again, if you're able, you don't have any allergies, if you're able to go down that road. Salmon, cod, organic salmon would be good too. Ghee, where tolerated, again, if you don't have any issues with dairy, but some people with dairy can still tolerate issues, can still tolerate ghee. And then limiting red meat would be really helpful on the anti-inflammatory side of things. Again, I know it's great to get the nutrients, but it is hard to break it down. It is inflammatory for the gut. So, and the WHO is even finally coming through with that as well, where it just really is quite an inflammatory food. So drinking enough water a day, drinking, I just put in 2 liters, depends on your body weight. But I think about maybe 35 milliliters or 40 milliliters per kilogram of body weight is about right. Um, so you can work out your own amount there. And you'll know yourself, obviously, once you're in the rhythm of things. But we forget ourselves sometimes, or, it can be hard, especially if you're lying down a lot as well. It can be hard to get enough water in. Um, so we get that, but including herbal teas can be helpful too. Obviously, from a therapeutic perspective, but kind of from an electrolyte perspective, some people find just water alone is a little bit harsh on the stomach. Even depends on how sensitive you are, what you're going through at that stage. So you could get your liquids in as well through some herbal teas, and that might be a little bit easier to take in for your body. The obvious again, but choosing whole foods where possible, fresh vegetables, your lean proteins, chicken and fish, turkey if you can. Everything is organic where possible. But obviously financially, that's understandable. Some people can't get there. Um, and also from an organic perspective, it's tricky sometimes of the year in Ireland to get certain things, which we understand too. But yeah, there's more available and it is becoming more competitive. So there's a lot less chemicals and a lot more nutrients in the organic where possible. Unrefined and unprocessed foods. And again, that's tricky when you don't have the energy. I get that. You don't have the energy to to make everything from scratch sometimes. So do what you can. That's the key, and not being hard on ourselves, not being stressed about it either, because obviously that's just creating more stress for the body to deal with, and that kind of negates the diet in the first place. But where we can, we do what we can, we be kind to ourselves and do as much as we can with that. Identifying and eliminating food intolerances is a big one, because obviously if there's a microbiome imbalance, it could be causing food intolerances, but also the food intolerances could cause the microbiome imbalance. And we've the chicken and egg situation again. When we have an intolerance, often we do need to remove it for a period of time, but often I do see people that are stuck, then they can never go back on it. So doing an elimination diet is a bit of gold standard. Or we can do some testing, which I refer to later, just to check out what is happening in someone's system, and what they're reacting to. You'll often know your own reactions, or you'll be close to finding it out. So the elimination diet can be really helpful, and naturopath can help you with that and guide you through that. And then really slowly reintroducing the foods over a period of time. But what's happening is they're creating an inflammatory response every time we ingest them. And so it's not about, I know a lot of people are off gluten and dairy, and for good reason, in autoimmune protocols especially. Um, but also what we want to do is just make sure that we're not creating that inflammatory response, but that we're also strengthening our system. So we're not limited down. I've met quite a few people, and I know my own past history has been you're down to about 3 or 4 foods because you're reacting to everything. And that's probably beyond the scope of today, obviously, but it can be so miserable, and there's a lot of suffering in that. And at the same time, every time you're trying to reintroduce something else, your body just says no to it. So we have to balance the inflammation and making sure we're putting in healing protocols so that you can strengthen your system and you can get back to as near of your normal diet, or as near as a normal diet as possible. And then just cooking with anti-inflammatory spices and herbs can be really beneficial, obviously, as well. So where possible, where tolerated, ginger and garlic, pepper, coriander, um, they're just a few. Obviously, there's, nearly all the herbs and spices are therapeutic and beneficial. Ginger is a really beautiful one to cook with and to have as a tea for inflammation. It's a really helpful one. Garlic is tricky for a lot of people with IBS because probably they have SIBO, which I'll come back to again later. So if you react to garlic, then don't do it. Yeah, just don't bring it in. Don't try and force yourself. But coriander is often very gentle as well in the system. It's really good for detoxifying heavy metals and contaminants like that. Exercise, big one, obvious one. Stress, you can certainly look back at this later. And sleep. And we covered that before, and certainly I can again. And if you were in an appointment, I would definitely go through that with you, but you can look back on that yourself. So key nutrients, glutamine. It's an amino acid. That's a big one. And it's something that's really helpful from an anti-inflammatory perspective. It heals and repairs the gut lining, the gastrointestinal lining. It also supports glutathione production, which is a really powerful antioxidant, which we need to balance inflammation in the body. And it improves the immunity in the gut. And so glutamine is tolerated by many, and it's really has very few side effects. It can be used for blood sugar control and balance as well, or if you get food cravings for sugar. And the only people that react to that are people that might produce too much of a neurotransmitter in the brain called glutamate from it. So some of the reactions, just to let you know, in case you think, well, she said this was good, and now I'm having, a bit of anxiety, or if you're getting kind of heart palpitations, not because there's anything wrong with your heart, but just more from an anxious perspective, and you've just started taking glutamine, you could be one of the small few that react in that way. So do stop taking it. It's not going to do you damage, but it will create anxiety in your system if you react to it that way. But generally speaking, most people actually do really well with glutamine. Vitamin A is really important to heal the mucous membranes in the gut. It's really good for the mucous membranes in the whole body, and it's often depleted really quickly when there's inflammation in the gut. Zinc is a really key building block for hydrochloric acid in the stomach, and it also helps to repair the mucous membranes, and it's good for the immune system. And if you have like peptic ulcers, gastritis, those types of things coming up, zinc is beautiful for that. It's really good for tight junctions. So for food sensitivities in the small intestine, it can help to repair. So if you've got food sensitivity, zinc carnosine particularly is really helpful. There's probiotics there that we'll all have heard of, as in generally probiotics we've all heard of, but the specifics, rhamnosus can be great for constipation, antibiotic use, and abdominal pain. I've just selected a couple. There's obviously many out there. And SB, or Saccharomyces boulardii, is really good for diarrhea, quick bowel movements, pain, distension. So that's the swelling of the stomach. And after or during actually and after antibiotic use, that can be really good to make sure we're protecting and healing the gut. And prebiotics, which feed the good bacteria, they can be really helpful to build up the immunity and the strength in the gut. And a really beautiful one is called PHGG, which is partially hydrolyzed guar gum. And that's really good for constipation, really good for SIBO specific constipation, which is actually called SIMO, but anyway, I won't get too technical about it. But if you have SIBO in the gut and you have constipation, PHGG is great. Again, very well tolerated, very good for sensitive people. Only thing I would say, there's a very small minority of people that react to it, and it's just nothing you can do. They just, their systems don't want it. It just causes more bloating. It's very small, but that would be kind of the main reaction, if any. And PHGG, it's a fiber. So what we want to remember with fibers is that try and separate them from, like, definitely if you're taking pharmaceutical medicines, keep them 2 or 3 hours away from them, because they can slow down the absorption of other medications. And so it's better to just take them on their own. Vitamin B12 can become depleted really quite easily with digestive imbalances. So that's something to watch out for. And obviously a big nutrient for fatigue, for energy, for mood, and for, our mental health. So that's something definitely watch out for. You can get shortness of breath, chest tightness. It's a very common thing in the microbiome imbalance conditions. And then digestive enzymes, which I referred to earlier, so don't need to go into them, but they're pancreatic enzymes, Magnesium is something we're probably all familiar with, but it really helps with the microbiome imbalances, and it really can be used in its form, citrate form, to help motility in the gut. So if you've slow motility and you're tending towards more of a constipation, definitely magnesium citrate. I don't understand unless you're using it for elimination processes to flush out the bowel, and that's quite a specific thing. I don't understand why people take magnesium oxide. It's in a lot of supplements. I think it's cheap and it's easy to produce and it's cheap to produce it, so they just stick it in there. But it's not absorbed well, and it creates yeah, like there's an increased motility with it. That's one benefit, but it doesn't absorb into the system very well. And then betaine hydrochloride, this is only specifically if your hydrochloric acid in the stomach is low. And so some people can, if they've low hydrochloric acid, can certainly take a supplement for this, and that can help to aid the digestion. But again, I wouldn't do that unless you have maybe some guidance with that from a practitioner, because if you've high stomach acid and you take hydrochloric acid, obviously it's very irritating. But it can be really beneficial in the people that have low stomach acid. You might find that, you know, your energy levels and your digestion of nutrients just goes up very quickly. And then some herbs. Chamomile is this beautiful herb. Yes, we know it as a tea, but you can take it as a supplement as well in higher dosages. It's a spasmolytic, so if you're getting spasms in the digestive tract, chamomile is beautiful for that. If you're getting cramping, nausea, and especially from nervous digestion, from stress, it's really specific for that, and it's a really good anti-inflammatory. So tea is great, but you know, take like 4 teas a day if you want to get some therapeutic benefit from it, or a supplement would be great for that too. Slippery elm, some may or may not be familiar with. It's high in fiber. It's also a prebiotic, so it's going to feed the good gut bacteria, good gut microbes. It's like a tongue twister. But it does reduce the irritation and it protects the mucous membranes. So slippery elm is from a tree bark in North America, and it was used by indigenous people. And so you mix it up. It becomes quite slimy. It's not very attractive to look at. It doesn't taste too bad, actually, I think. And you just down it. You mix it up with some water, and you mix in the powder. And what it does, again, I wouldn't take it with medicines because it might slow the absorption. But taken outside of that, you know, 2 or 3 hours away, what it does is it lines all the mucous membranes. It provides this beautiful soothing. It's called a mucilage that protects the mucous membranes, and then you're healing those areas in the gut. Ginger, we talked about earlier, nausea, inflammation, beautiful in a supplement form. Tea, absolutely perfect as well. If you have gastroesophageal reflux disorder and you're getting a lot of regurgitation, I wouldn't go with ginger because it's probably going to aggravate it a bit. Some people I know are okay with it, others are not. Peppermint is probably a bit more of a trigger for GERD than ginger, but it's a 50-50. So you could try a little bit and see how you go if you have that condition. But it's not to be used if you've got gastritis or ulcers because it can irritate them. So if you do know you have those conditions, if you're getting gnawing or burning in your gut, stay away from ginger because it can be a bit too much. Meadowsweet, which we'll often see in Ireland, it's a lovely one. It's a stomach tonic, so that can help to balance the acid in either direction, which I love. And it's an anti-inflammatory, so that's lovely. And certainly you could take that as a tea or as a supplement. Antimicrobial herbs, you can have garlic, oregano, berberine. There's other ones as well. They're really helpful if you know about an infection, you've done a test, or if you know about SIBO and you've done a test, or if a naturopath has diagnosed you with something, or a doctor diagnosed or a naturopath is supporting you. I wouldn't take them just willy-nilly. They can wipe out a lot of the good gut bacteria, good microbes. So I would be mindful about that, but they can be really helpful as part of a targeted approach to balance the microbiome, and they're very effective, if not more than antibiotics in a lot of cases. And then your liver and gallbladder support herbs. You've got your St. Mary's thistle, which a lot of people have heard of, or milk thistle, maybe you might know it as Saliva marianum, and dandelion root, not leaf. Dandelion leaf is known a lot as being a diuretic. The root is more helpful for the liver gallbladder function. And you can get lovely roasted dandelion root teas, and that's tastes lovely, tastes like a coffee. That can help. But I'd also, advocate the supplements for that too. And globe artichoke is a lovely herb for the gallbladder. So you're getting the motility working better, you're getting the fat digestion process working better with those supportive herbs. You'd have to check if you're taking medications with nearly every herb, and some supplements. If you're taking pharmaceuticals, do ask somebody, will this interact? And that's again where a naturopath would check. Like I would have a system where I can check the potential interactions between herbs and drugs. So it is important. Tea form, less so, like chamomile, maybe in a tea, you're less likely, but still. And then your flower essences, just specific more so for the digestive system. The Australian bush flower essences, pawpaw is a beautiful one for digestion, and crowia is for worry, and so that's a good stomach tonic as well. And then the others are listed there, so you can definitely look back on them. But you've got anything from anxiety, overthinking, overwhelm, nervous digestion, and if you're just one of those people, impatience, if you're just one of those people that is kind of on the go and you get frustrated and impatient with people really easily, that can definitely interrupt the digestive process. So that can be a lovely one too. You can get them combined. You can get someone to make up a bottle for all of those in one, or you can take one in particular and focus in on that one. They're beautiful. You can take them as you wish, really. Like you just away 15 minutes away from food and drink, and they're very sensitive. Testing options. Again, these are the tests that I would run with people: SIBO, breath test, um, comprehensive stool analysis, and that has a list of all the things that we can look at. Adrenal function tests obviously are really important within ME and digestive system as well, because they affect each other obviously when we're stressed. IgG food intolerance tests, I know a lot of people have heard of these. And then your organic acids test, which is just testing your nutrient status and any toxins, toxic elements that are there. The biggest ones here we're looking at are SIBO and comprehensive stool analysis. The doctor's surgery can do some stool analysis testing. It's not anywhere like this in terms of comprehensiveness, unless they're specifically trained in a very specific area and they specialize in this. But the standards won't. And then SIBO as well. I don't know. I mean, sometimes in Australia they did SIBO breath testing in doctors' offices. I haven't heard about it as much in Ireland, but maybe you'll tell me differently. But I haven't heard so much about that. You drink a solution, you do a breath test. Um, SIBO is a big one. Honestly, all of the symptoms that I've described today, anyone who's been labeled as having IBS, I'd be surprised if it's not SIBO. Like the percentages are huge. I can't remember off the top of my head, but the research is showing that SIBO is most often the problem when someone has IBS symptoms. And if you don't get that in check and balanced, it will continuously just cause problems. It's just a horrible negative kind of a loop that happens. But it is absolutely a positive. It's absolutely treatable. It can recur, but there's a lot that we can do to support the system and to kick it off and to get the right balance back in the microbiome with it. But hopefully that gives a lot of a lot of general information and a lot of hopefully some specific things that you can add in or that you can do for yourself to balance.